Right now, 1 in 4 people on Earth is walking around with a liver that is actively degenerating. The tissue is slowly filling up with pale yellowish fat, suffocating the healthy cells. While liver failure is traditionally associated with heavy drinking, this specific epidemic occurs in patients regardless of their alcohol consumption. This is non-alcoholic fatty liver disease, or NAFLD. While BOFI, obesity, is a primary risk factor, up to 20% of sufferers maintain a completely normal body weight. The liver is buckling under a systemic metabolic malfunction that remains entirely invisible to the naked eye. This initial accumulation of fat is known as the first hit. When insulin resistance disrupts the body's energy regulation, the liver is forced to store excess triglycerides directly inside its own cells. Standard medical guidance focuses on mechanical countermeasures. Low-intensity, steady-state cardio provides a slow, continuous fat burn, while high-intensity interval training forces a metabolic reset to clear those lipids. For millions of people, this stored liver fat remains benign. However, in a significant number of cases, the condition mutates into NASH, a state of severe inflammation that leads to cirrhosis and eventual liver failure. This mutation is caused by a second hit, a physiological assault that targets the body while it is completely unconscious in bed. During obstructive sleep apnea, collapsing airways cause overnight oxygen drops. This chronic intermittent hypoxia stresses organs, forcing liver cells to activate the HIF-1A protein. This triggers aggressive collagen overproduction. The proteins cross-link and harden, permanently transforming soft liver into rigid scar tissue, fibrosis. These nightly events function as a literal choking mechanism, forcing the liver to suffocate and scar itself until it can no longer function. The lack of oxygen is only part of the nighttime assault. Because human organs operate on independent biological clocks, sleep deprivation causes the digestive circadian rhythm to fall out of alignment. This misalignment leads to gut dysbiosis. Beneficial anti-inflammatory bacteria die off, allowing harmful bacteria to overgrow. These pathogens produce toxins called LPS, which seep through the intestinal wall, travel up the portal vein, and spark violent inflammation in the fat-burdened liver. Disrupted sleep effectively turns the digestive tract into a toxic engine that inflames the liver from the inside out. Physical exercise alone cannot overcome NAFLD if the nighttime hypoxia and gut inflammation are not neutralized simultaneously. Protecting the liver requires a nighttime defense. Melatonin is used to suppress the inflammatory cascade, while vitamin E acts as an antioxidant to shield the cells from hypoxic stress. In this medical context, poses like the frog pose or Kapalbhati breathing function as deliberate mechanical tools. These movements compress the abdomen to manually stimulate blood flow. This mechanical pressure helps flush the digestive tract and improve circulation through the liver's complex internal structure. Recovery depends on managing the pressure and chemistry of the gut just as much as the health of the liver itself. Stopping the progression of NAFLD requires a 3-pronged protocol: cardio to clear the triglycerides, sleep correction to restore oxygen, and gut health to stop inflammation. Once these second-hit attacks are halted, the liver can utilize its unique biological ability to physically regenerate and repair its own damaged tissue. The liver is designed to endure and rebuild, but it can only save itself once you align your breathing, your gut, and your biological clock to give it the fighting chance it needs.